Today we're going to be talking about carpal tunnel syndrome, things that can mimic carpal tunnel syndrome, and also what your chiropractor can do for you to alleviate some of your symptoms. Hey everybody, Dr. Brittany here with Bloomington Wellness Center. Today we're going to talk a little bit about carpal tunnel syndrome and some of the things that can mimic carpal tunnel syndrome, and then what we as chiropractors can do to help you with some of your symptoms. So true carpal tunnel syndrome is what happens when a nerve that supplies your hand gets trapped in an area of your wrist called the carpal tunnel. Sometimes it can get compressed in that area, sometimes it can just get irritated, and what happens is it starts to give your wrist and your hand different symptoms like numbness, tingling, burning. Sometimes your hands can feel weak, that kind of thing. What tends to happen these days, since we're all stuck at computers and texting and doing repetitive motions, is that we can all get these kind of symptoms in our hands. A lot of times, the term carpal tunnel syndrome tends to get kind of broad-based as kind of a diagnosis, even though there's a lot of things that can cause this type of pain in your hands. All of the nerves that supply your wrists and your hands actually starts up here in your neck. They exit in the spaces between your vertebra up in your neck, and then they come all the way down this part of your arm, all the way into the arm before they supply your hand. So what can happen is that the irritation can sometimes start up here in your neck. Sometimes it can get compressed anywhere along the arm within muscle tissues or different joints that can get stuck in your arm. Or sometimes it can actually be all the way down in the wrist and in the hand, especially in this portion of your hand where these nerves supply your hand. So what we as chiropractors are going to do is we're going to address this entire what we call kinematic chain, meaning this whole area that the nerves are coming from. What we'll start with is we're going to evaluate different parts of your neck and make sure that there's no irritation of any nerves coming from this area of your spine. Then we're going to check all the different areas of the pathway of those nerves, some different areas in the elbow, some tissue work we can do throughout here, and also some adjustments in the wrist to make sure these bones that run alongside those nerves aren't putting any irritation on the nerve. By doing so, we can take pressure off of those nerves, which a lot of times can help alleviate all of that pain, tingling, burning, and all those symptoms that you're having in your wrist. If you have any questions about this or any of our videos, please feel free to leave a comment. Otherwise, if you like our video, feel free to share it with your friends and subscribe to our channel.